Now, we can also opt for a surgical procedure in the particular patient. And in a lot of patients, whenever we are suspecting the adenomas or the carcinomas, we opt for the transsphenoidal surgical resection. Sometimes the roots are changed. We can have a frontal approach to the resection as well. But the usual approach that is basically encountered in these patients is the transsphenoidal approach in these patients. You usually traverse the sphenoidal bone and then you enter and then you perform the debulking surgeries on the pituitary gland. As you can even evaluate over here, this is the pituitary gland that is lying in the sella turcica. This is the bone. This is the depression that is basically accumulating this pituitary gland. This is present in the sphenoid bone. And then you have the surgical instrument that is entering the sphenoid bone and then entering the sella turcica, that is the depression. And then you can perform the debulking procedure. Then you can basically get rid of the cancerous tissue that is present at this particular point. So basically avoiding any damage to the cortical region, any damage to the hypothalamic region, and you're just reaching the sella turcical region, which is basically accommodating the pituitary gland. So this is a very safe approach towards the pituitary gland, and you can easily reach by this approach to the pituitary gland and perform the debulking procedures or perform the procedures for the resection in the patient. Again, it is basically going to depend upon a lot of factors: the generalized health condition of the individual, the age of the individual, the comorbidities that the patient has, and basically the outcomes are going to rely upon all of these particular factors. So in this particular lecture, basically, we discussed this endocrinal abnormality, which is known as the acromegaly in the individuals, and how the growth hormone is released into the bloodstream and what causes the spurt in the growth hormone in the bloodstream, and obviously the effects of this increased levels of growth hormone in the bloodstream are going to be devastating for the individual. We must know how to modulate the treatment plan for the particular patient, and that is how we go about and manage these patients of acromegaly. So that is the end. Thank you for watching sqadia.com.